Yes, now another wonderful Saturday, and as it be Saturday, as we dey take do am, we dey always discuss health, cause health matter, health shekoko, and the person wey dey take us through this journey on top how to stay healthy na no other person but Dr. Bat Ofegbolam, the CEO, Grace Valley Medical Center, also a medical consultant. Good morning, sir.
Yeah, thank you very much, Chief.
How are you doing, sir?
Yeah, I'm so pleased to be back.
Yeah, good morning once again.
Slimmest of them all.
Yes, Chief, good morning.
Good morning.
Doctor, good morning.
Lovely head.
Thank you.
As always.
You know.
Good morning, viewers at home and around the world. My name is Dr. Bath Tochukwu Febunam. I'm the Medical Director of Grace Valley Medical Center. We're happy to be back today on Health Mstta on WAP TV. And this morning we'll be looking at a very common and popular medical condition or topic that each and every one of us must have had at one time or the other. Every November 14th, the world marks World Diabetes Day. So 9 days ago was World Diabetes Day. So this morning we'll be looking at diabetes mellitus. As we always do, we'll talk about the definition, we'll talk about the epidemiology, we'll talk about the pathophysiology, we'll talk about the causes, the risk factors, the modifiable risk factors, as well as the non-modifiable risk factors, as well as prevention. And then hopefully we'll be able to conclude with treatment if the time will allow us to go that far today. So diabetes, as we all know, is a medical condition or a chronic disease that is characterized by an abnormally elevated blood sugar or blood glucose over a prolonged period of time. Some authors describe it as a group of metabolic disorders that is characterized by hyperglycemic state. In other words, abnormally elevated blood sugar in the blood. It oftentimes, usually when untreated, it can predispose an individual to a number of complications that can affect almost all the organs of the body. It can affect the eye. If someone ends up with a complication known as diabetic retinopathy, affecting the small blood vessels of the retina of the eye, the person will start having vision challenges and progressive loss of vision. Oftentimes, it could end up in blindness. If it affects the kidney, the person will have diabetic nephropathy. The person could also have diabetic neuropathy, loss of sensation when the nerves are damaged. If it affects the blood vessels, it will give rise to a number of complications. Top on the list is CAD, coronary artery disease. It can also cause peripheral artery disease, which we are going to look at in the course of this program today. So, what are the symptoms of diabetes and what are the types of diabetes? Majorly, there are three types of diabetes: diabetes type 1, diabetes type 2, as well as gestational diabetes and others. Okay? Now, diabetes type 1 usually starts or is common in children and young adults. That's why in time past, it was referred to as juvenile diabetes or insulin-dependent diabetes. But these names are no longer in use. Okay? What that means is that anybody who has type 1 diabetes will have to depend on insulin. Before the advent of insulin, about 100 years ago, it was almost more or less a death sentence on anybody who ends up having such a condition. There was no hope. Okay, so this group of people that have type 1 diabetes will have to depend on insulin therapy. What is insulin? It's a form of hormone that regulates the uptake of glucose in the human body. Okay, it's responsible for making it possible that we're able to get glucose from the food that we eat on daily basis. Okay? The second type is diabetes type 2. Diabetes type 2, in time past, it was referred to as non-insulin dependent diabetes, meaning that people who have this condition may not depend on insulin to stay alive. Now, the major difference between these two conditions is that in diabetes, the common pathophysiology in diabetes is that there are challenges with insulin, with this all-important hormone, insulin. Okay? It's either that insulin is not being produced enough, or the one that is produced is defective, or the body is not able to utilize the insulin that the system has produced. Okay, so in type 1, you have insufficient or absent production of insulin. In type 2, the insulin production could be normal in type 2 diabetes, but the major challenge is that the cells of the body are not utilizing it appropriately the way it should be done as a result of unresponsiveness of the receptors, as well as resistance, what we refer to as resistance to insulin by the cells of the body. A little bit of the pathophysiology so that we can have a clear understanding of how these things play about. When we eat food, whatever we eat, let me start by talking about the major classes of food. If you eat carbohydrates, the end product of carbohydrate digestion, if we can remember some of the
Glucose.
secondary school biology that we were taught. Okay, so they've just answered correctly. The end product of carbohydrate digestion is glucose or sugar. So that means if you eat yam, what your body will get out of the yam you have eaten will be sugar or glucose. Also, for protein, the end product of digestion of protein is what? Can you remember, Chief? Can you remember?
Prolactin. No, it's not prolactin.
Okay, so the end product of, amino acids. Yes, you're a good student. You were a good student. So the end product of protein digestion is amino acids. Now, these are the smaller molecules or micromolecules that the system, our body system, will be able to absorb. Okay, so we're narrowing down to carbohydrates now. So when we consume carbohydrate-containing food, it gets into our system, there are three major areas through which absorption of glucose can take place in the body. Number one is intestinal absorption. Okay? This is brought about, the uptake of this glucose is brought about by the activities or action of insulin. Number two, some of the glucose that the body may have stored in some places, in some parts of the body in time past, can equally be broken down through the process of the glucose that the body stores are usually stored in form of glycogen. Very good students. Are stored in form of glycogen, usually in the liver and muscle cells. Now, in terms of, in periods of lack, probably when one is fasting and you're unable to eat food for one reason or the other, what happens is that your body will start breaking down this previously stored glucose in form of glycogen to generate glucose. So that's the second way that the body can generate glucose in the body, and it is called glycolysis. Okay? Now, the third way is when the body is in lack, it can generate glucose from non-carbohydrate sources or substrates in the body, from protein synthesis, for example. This aspect of production of glucose is called gluconeogenesis. Okay? The first one is intestinal absorption through the food that we have eaten, the body gets glucose. The second one is when glycogen that were previously stored are made to be broken down, the body generates glucose. And then if in some situation, the body may go beyond all of this, and non-carbohydrate sources or substrates could be broken down, gluconeogenesis, and glucose will be produced in the body. Now, what happens is that the job of the insulin is to ensure that these glucose are transported to cells where they will be used to generate ATP and energy that we can use to move about, we can use to talk, we can use to walk. Okay? But sometimes there could be issues with the production of insulin in the body. The aspect of the body that produces insulin is the pancreas. Okay, now the area of the pancreas that produces insulin is called the islet of Langerhans. Okay, so the beta cells of the islet of Langerhans produces the insulin that the body uses. By some reasons that are not yet fully known to medicine, these beta cells become destroyed at a very early stage in life.
Sorry, sir, just asking, is the beta cell what we call, that pancreas, is it what we call bile? That very
No,
beta,
no, that's not bile, sir. Okay. Bile, that has to do with the gallbladder.
Yes.
Usually located, embedded in the substance, is under the liver, on the substance of the liver.
Animals
When we kill chicken.
yeah, they'll tell you that you should just take your time to cut it off.
Okay, so back to the
Your pancreas.
yes, the pancreas. So for some reasons that are yet not known, the beta cells of the pancreas get destroyed. And when they get destroyed, it will result in reduction in the production of insulin by the body or a total absence. And when that happens, such a person will come down with type 1 diabetes. In some situations, the pancreas can be functioning normally, and then the insulin production is also normal or maybe abnormal, okay? But the cells that should take up this insulin is refusing to do so. We'll call them resistance. And that, of course, will give rise to type 2 diabetes. And when you have this hyperglycemic state, the glucose accumulating over time in the blood, it will start causing some challenges. It will exceed the threshold of the kidney. And what will happen is the kidney will start pushing out glucose in urine, and the person will start passing out glucose in urine. In the olden days, our forefathers, the way they usually dictate who has diabetes and who does not is that they could take, they could take three persons. If they suspect that somebody is urinating frequently and such a person may have diabetes, because it's not only diabetes that can cause frequent urination, they may take them to say, okay, if you want to pee on this particular cycle, the three of them are made to urinate on different cycles at the same time, and they will move away from it and come back over a period of time, maybe 30 minutes. When they come and discover that the ants have circled a particular spot, what it means is that such a person has passed out glucose in his urine. Okay, so it's abnormal to pass out glucose in urine.
Dr. Ba, do you now believe that our forefathers are medical doctors?
Right.
Yes. Yeah.
We said we try. Okay, let me pause you there a bit so that we can actually go on this short break. Immediately we'll come back here. Dr. Bat will continue. Go nowhere. Health Mstta and I will still do.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show wey dey help people. Terms and conditions apply sha o.
Yes, thank you very much, Dr. Bat, for that diagrammatical analysis which you have just given to us. We say diabetes, now we discuss basically, and you don't tell us a type 1 and a type 2D. He has also given us an insight into what insulin is. He has given us an insight into what pancreas is. But Dr. Batsa, before we go on, we go open phone line, and of course this is a question segment. So let me open the phone line first, then we'll actually play with some questions here.
Okay. Alright, so guys, Dr. Ross, I'll talk to Dr. here to answer your questions. Alright, 08105434981 or 08173147589 be two numbers to call us on.
Okay.
Chief, you want to start with your question?
Yes, sir.
Ma.
Carried away. Okay, I have 3 questions here.
I've
Number
got
one, sir, from the diagrammatical expression we saw there, is diabetes really curable if detected early? I mean, early detection of diabetes, can it lead to a cure? Because most times they say diabetes no dey curable. That's one. Number 2, the reading. I don't know if we will still get to that, but sometimes last week when we did diabetes on top fine girl segment, we actually
particular
day, we talked about the reading. Some of us don't go take our reading, but we don't know
which one high, which one normal,
high, which one low. With your wealth of experience now, at least we are guided on 120/20 or 140 as per
for BP.
So we would also need you to help us do clinical analysis to the reading so that we can be guided. Because most of the people will call us that they safe, they just do reading. And they go ask doctor, am I fine? You are fine. Thank you. Nobody know when they high or how to manage it. Then the last question I have here, if we really stay away from sugar or sugary things, is it possible not to ever experience diabetes?
Or you are, just to add to what he said, or you are still at risk if it's in the family, you know.
Yes.
And then, doctor, which one is actually preferable so that you can just answer everything at once? You know, I hear of low sugar level, I hear of high sugar level, and I think the two of them are actually not good signs. So which one do you think is supposed to be? Like, is there a moderation, or if it's too low, this is what you come down with, and then if it's too high, this is what you come down with?
Okay, the first question is,
thank you very much. Ladies first. Let me tackle hers.
Ladies first.
Yes, in the spirit of, let me tackle hers first. Now, talking about levels of sugar in the body, 2 medical names will quickly come to mind. Hypoglycemia, when you have low sugar. Hyperglycemia, when you have high sugar in the blood. Okay? Now, what is taken as low sugar, or now you need to stay within the range. By answering that question, of course, I will also deal with one of his questions. You need to stay within the range. Now, the range of 60 to 110 is regarded by some authors as normal range. Okay, so but you also need to differentiate what parameter you're talking about here. Okay, so if you're talking about fasting blood sugar, it has a different value. If you're talking about random blood sugar, it has a different value. Now, random blood sugar is when you casually when one casually takes his or her blood level, having had a meal earlier in the day. Okay? That's the one we refer to as random blood sugar. But fasting blood sugar is in a situation where you measure your sugar level having woken up before eating having fasted for more than 12, having not had meal, let me not use the word fast, for more than 12 hours. Okay, so that one is referred to as fasting blood sugar. We expect that to be within a particular range, 60 to 100, or some say 110. Okay, so if you have your fasting blood sugar within this range, you are good.
But sir, the counting must be 12 hours.
Must it be 12, or can it just be from night to morning?
Yes, from night to morning, but I just say this for scientific purposes.
Because why I said so, let me quickly give you an instance.
Because you can't wake up by 3 a.m. and eat food, and then by 7 o'clock you're thinking of having done a fasting blood sugar. That should be random.
I ate around 11:35 p.m. and I was supposed to do fasting blood sugar the next day, and they told me that I should not, that it's by 9. By the 9. Morning. So I did my 9 a.m. in the morning. Can we call that fasting? 11:35 p.m. to 9 a.m.
Well, roughly you can actually say yes. Yes, but ideally it should be at least 12 hours.
Okay.
You may not have
Now
eaten
we know.
anything before 12 hours,
That's
meaning that
amazing.
if you ate
10.
at 9 p.m. yesterday, by 9 a.m. in the morning, you're
You
good to
can-
do fasting blood sugar. Not when you wake up early hours of the morning to
To
take
eat,
yeah,
and
to
then
eat
you now say you
eba.
want to.
and then in the morning you go to say, have you eaten this morning? You said no. You say no, and then you think you have. Okay, so what you be testing at that particular time will be random blood sugar. Okay,
So what's the reading for random, sir?
now reading for random for someone who has eaten will hover between 60 to 180. Some researchers say 60 to 120. Okay, now but what we refer to as diabetic range. Okay, but before that I'll talk about pre-diabetes. Pre-diabetes is just like a precursor to type 2 diabetes. It's just
We call
wait
it signals.
where you have derangement. Just wait about the time that your system is giving you a warning. Okay, that you're on the verge of becoming out. We have Emmanuel from Benue. Emmanuel, good morning, sir.
Good morning.
How you doing, Emmanuel?
I'm very okay.
Okay, Emmanuel, you need to speak a bit louder and go. Speak louder, please, and go on with your question.
Okay. First of all, I want to thank the doctor in the studio.
Thank
Thank
you
you very much,
sir.
Discussing is so touching.
Thank you, sir.
The matter they are discussing is so touching and it's very interesting. I thank the doctor for that matter.
Thank
Thank you,
you.
sir.
Wow. And like we in Benue State, they are talking about the type 1 diabetes. And according to what they are saying, that it is all those carbohydrate foods that give rise to the sugar or glucose. And we in Benue State, we normally cultivate much yam and
Pounded yam.
Food basket.
yes, and we consume pounded yam. In fact, we eat yam in the morning, we eat yam in the afternoon, all this in the evening before we sleep. And this is a continuous process. So I don't know if consuming yam is good to health, or I don't know that are we going to suffer diabetes type 1, or how are we going to see? What kind of food is there recommended for in the morning or for with the Benue people? Because we consume mostly yam, and if anything is to add, it's right.
Can
So how are we
address
going
that.
to
That's
go
like
about
the
Yes,
food.
so pounded yam. Okay, our nutritionist. Nutritionist,
Yes,
Dr. Bat.
that's a very practical question. Thank you very much, sir, for your kind words and your wonderful question. Because in this environment, not just in Benue, of course, Benue
Even
State is
Nigeria,
regarded
yes.
as a food
Food
basket
basket.
of the
Yeah.
nation. Okay, so not just in Benue, almost all around us. Okay, even as a person, I think I prefer the carbohydrate food much more than any other, because these were the things that were brought up with.
If you don't eat rice, it's like
village.
you don't
Yes.
eat yam and
Amala.
egg.
You eat amala in the morning.
But
Eba.
I quickly want to make, yes, lifestyle modification, okay? Let me start by saying that there are modifiable risk factors and non-modifiable risk factors. Now, the non-modifiable risk factors are the ones that you do not have a say. You
don't have
cannot
control
actually
over.
change. You don't have control. That's the word. You don't have control over them, okay? For instance, people who have type 1 diabetes, some of them were born with the genetic makeup that will predispose them to that later in life. So such a person does not have a say over it.
So even when you try to moderate your
Yes. Okay, but if you have type 1 diabetes, it was brought about by autoimmune destruction of the beta cells. We talked about that in the initial stage, we talked about the beta cells as being responsible for the production of insulin, the all-important hormone insulin in the pancreas. So it gets destroyed by an autoimmune mechanism. The body system begins to attack its own body. What is responsible for this is not known. So people who have such challenges will come down with diabetic type 1. Chinedu from Nasarawa will come back to the question.
Good morning, Chinedu.
Good morning, my brother.
How are you doing,
Thank you
sir?
very much.
I'm fine.
Okay, to your question, please.
Okay. Doctor, good morning.
Good morning, my brother.
Good morning, everybody.
morning.
All
Good
right.
morning, sir.
I'm enjoying your program seriously. So
Thank
I
you
want
very
to ask
much.
a question. I'm added to what Emmanuel said from Benue State. You know, we Nigerians, we are all based in carbohydrate food. So I'm asking, what are the symptoms of this diabetic from the beginning, and what can we do to survive from some of food we are eating?
Thank you very much, sir.
Yes.
The question is somehow related to that of Emmanuel that we're trying to deal with. Okay, so in terms of, we are still going to tackle your questions. They're hanging on the air. Now, in terms of what he has asked, okay, this year's theme for World Diabetes Day is family and diabetes. So we are going to look at it. What do we need to do as a family? And of course, that brings us back to the ones I was about talking about, the modifiable risk factors. Okay, so the modifiable risk factors have to do with what you and I eat. Has to do with our diet. Okay, has to do with our lifestyles. Okay, in terms of diet, you need to do more of Mediterranean diets. I will explain what I mean by that. When you Google, you see Mediterranean diets. It's usually diets that people in Italy and Greek were used to. Majorly, the diet is has to do with fruits and vegetables, and then the type of oil they use is olive oil. Okay, so that's what we have in Mediterranean diet. There's also what we refer to as DASH diet, dietary approach to stop hypertension. It has to do with fruits and vegetables, plenty of fruits and vegetables, nuts, less of high caloric food, and then nuts and cereals. Okay, now, but I was trying to point out a distinction that if you have type 1 diabetes, it doesn't have to do, it wasn't started by your lifestyle. Okay, what started the problem was something you did not have a power over. In the sense that the cells that are responsible for producing in your body was just destroyed by an unknown mechanism, okay, autoimmune mediated. In some situations, it could be from an unknown etiology, unknown cause.
Could
okay,
the be
now,
part of it, huh?
Yes. Now, but for type 2 diabetes, that is the one that our food can affect.
Oh, wonderful.
So it's type 2 diabetes that our intake of food can affect. Our inactivity can predispose us to type 2. And usually it comes during our adulthood, usually from the ages of 20, some say 35 and above. Okay, so we'll call it adult onset diabetes. Okay, that is the one that we need to do modify the things around us so that we don't end up sometimes we could end up being able to delay it. Just like we saw in that some of the statistics that were shown to us, that 1 out of every 2 people has an undiagnosed diabetes. And WHO said that about 422 million people are currently living with diabetes all over the world. And it usually causes in the neighborhood of 3 to 5 million deaths globally. Okay, so it's a disease that has worldwide affectation. In terms of the symptoms that you talked about.
Sorry, sir, before you go to this, you said something now in terms of year. Does that mean that once a man escapes 35 years, he cannot actually come down with?
As a matter of fact, it comes with increasing age. Diabetes comes with increasing age.
Type 1, no, I mean type 1. Does that mean one have escaped type 1?
Usually type 1, somehow, that could be true because type 1 usually will come earlier in life, in children and young adults. Okay, so by the time if you're having diabetes and you're 35 and above, you're not likely to have type 1. You're likely to have type 2. We have Solomon from FCT. Solomon, good morning.
Good morning, Solomon.
Good morning.
Mr. Solomon, are you there?
Yes, I'm here. Good morning.
Okay, you need to make yourself audible, please. Good morning, sir.
Good morning, sir.
Okay, welcome to the show. Doctor is here.
Thank you. I want to know the symptom of diabetes.
The symptoms.
Now we're in there now.
Now where he was actually.
Thank you very much. 2 people have asked. So symptoms of diabetes that we need to know. Number 1, frequent urination.
Dr. Slimy.
Yes, frequent urination. That is not to say that there may not be other causes of other medical conditions that can actually give rise to frequent urination. Number 2, increased thirst. Frequent urination in medicine, we'll call it polyuria. Increased thirst that the person will continually crave for water. Okay, we call it polydipsia. Increased hunger, we call it polyphagia. Okay, so there are other signs and symptoms too that are not just specific to diabetes. The person could have, for instance, fatigue, unexplained weakness. Okay, now, now, let me paint a typical picture that everybody will understand. Diabetes, a layman can actually view diabetes as suffering in the midst of plenty. You have plenty of blood sugar in your body system, yet your body cannot make use of it. It's just like somebody being in a pool of water and yet soap is getting into one's eyes. So you have plenty of blood glucose and your body system cannot make use of them. And as a result of that, is causing a whole lot of challenges and damages to your body. It damages the vessels. If it damages the blood vessels, it can give rise to coronary artery disease, which can give rise to heart attack. As a matter of fact, 75% of death that usually come from diabetes and complications of diabetes can be traced to cardiovascular diseases. Okay? So in some situations too, you could have abdominal symptoms, nausea and vomiting. These are non-specific symptoms that can be found in any other disease condition. But specifically, excessive urination, excessive thirst or craving for water. So these are usually what you should look out for.
But
so,
Dr. Matta, sorry to cut you, sir. We have most times seen where people get diabetes, they're very careful not to get caught or injury.
It doesn't get healed.
Those will get time, they get ill. Is this a fallacy or it's for real?
It is not a fallacy. It is not a fallacy. Now, if you understand what happens in diabetes, like I said, it causes damage to the blood vessels, both the macro vessels and the micro vessels. The micro ones are the ones you have in the retina of the eyes. That's the tiny, tiny vessels that may not be visible to the naked eyes. Okay, so if it damages it damages blood vessels. Usually the arteries get damaged anywhere in the body. If it damages blood vessels that supply the lower extremities of the body, the legs, the person will come down with peripheral PAD, peripheral artery disease. And that is what is responsible for some of the skin lesions and wounds that we sometimes see. Okay, people who have diabetes also have easy bruisability. What does that mean? They can easily get injured. They can easily bruise their skin. Okay, the tendency to bruise their skin is very high. Okay, so people who have that condition are predisposed to that. Now, what happens is that there is a reduction as a result of this damage to the blood vessels that convey blood to the lower extremities. You have a reduction of blood flow to that part of the body. So when you have an injury there, one of the reasons why the wound may not heal as fast is that blood supply to that region of the body may be compromised. It may not be what it should be. Okay, so you see people with diabetic foot. Also, if the sugar is not controlled, the wounds will not get healed. Okay, if the sugar is not, that brings me to the concept of ABI. Okay, we have Gladys from
Gladys, good morning.
Good morning, Gladys. We are glad to have you.
Good morning.
Excuse me, please.
Bless you.
Gladys, please help us speak up.
Hello.
Hello, good morning, Gladys.
Good morning.
Yeah, good morning.
Thank you, sir. There was an issue that I know of, somebody with diabetes. But what the person was doing, each time he will soak gari in water and be drinking the water. He was not drinking the gari, but he was always drinking the water from gari, sour gari. What is the meaning of that?
Thank you very much. Thank you very much. No, what the person is doing is that the person is consuming carbohydrates.
Even without taking the gari?
Yes. When you soak rice in water and you don't cook it, of course you have some form of nutrients coming out. The starch going into the water and all. Sometimes we advise mothers who have children, if you can't lay hands on ORT, you can give your child that is stooling and vomiting rice water. Okay, so that can also make up. So even the water itself have some components of carbohydrates that have been,
so there's no point
poured into it. But the concept is, the idea is not this, that anybody who has diabetes type 2 should not eat carbohydrate. No, we haven't said that. What we are saying is that you should do minimal, you should do there should be some degree of dietary restriction. For instance, if you're diabetic, it doesn't mean you can never eat rice or you can never eat yam or you can never eat what other common food we have. Yes, it's not a deprivation. Okay, so for a number of us, what we usually tell our patients is that it's not that you can't eat all of these things forever again. Usually we have some of us have 3 categories of advice. There are foods that you need to completely avoid. Okay, but there are some foods that you need to eat only a little, and of course there are some food that you need to eat as much as you can. Now the ones you need to eat as much as you can will include vegetables, okay, fruits and vegetables, and some sources of and also some animal protein too. Lean meat is also good.
Okay,
now
Dr. Ba, before we go on, sir, most people actually say bitter leaf water reduces sugar, and when we were young, they will wash efirin, saint leaf, wash bitter leaf, the true water, mix and
I thought
give
that
us
was for
drink.
blood supplement.
What can you say, Abi? What can you say about that? Bitter leaf water, even saint leaf efirin.
my brother, let me look at it this way. The discoveries that are currently being made in the world of health have made us doctors to take our time before we can actually disregard or wave something out. Now, this same bitter leaf that you pointed out, I can tell you that there's an ongoing research that it has a lot of medicinal value. Okay, so I cannot just say that those things that are practicing that are not benefiting.
Okay.
But what I can say is that the science behind that, if
Has not
any,
been
is
proven.
not yet known. Okay, so but I won't say no,
Yeah,
it doesn't
you won't
work.
just disregard.
I don't have information.
But
I don't have clinical evidence to say it doesn't work.
In a layman's sense, sir, we know this thing.
But it's not what I would recommend as a doctor.
I understand, sir. In a layman's sense, sir, we know this thing has to do with sugary things. So consuming stuff like bitter cola too. You know, bitter cola
Because it is bitter. No, that's just looking at it from
by word and opposite.
Yeah, but from a logical point of view.
from
So in terms, yes.
hospital.
So in terms of the diabetes, if you have diabetes type 2 and your family has prepared a lovely meal of rice and you don't have any other option, you can eat it. What you can do is what you were used to, eat 1/4, 1/4 of what you were used
So it's
to,
not like
and
you
then
must
add
finish
plenty
it.
of vegetables. That will not upset the apple cart if you do that. Okay, ditto for yam or ditto for amala. We are not saying abscond from them completely. You don't need to do that. What you need to do, eat
a little.
Regulate, manage.
manage what you
eat
eat with moderation, and of course take your medications if you've been placed on medications. Permit me to also point out that it is not all the time that when we make diagnosis of diabetes that we put the person straight up on drugs. Sometimes you could ask the person to do a number of lifestyle modification, take to exercise, shed weight if you need to. As a matter of fact, if you're able to shed about 7% of your weight, you will reduce your chance of having diabetes by as much as 58%.
Wow.
So weight shedding or weight loss is a thing that we must ensure,
important.
because why do we talk about that? It's not just gaining weight. If you have a BMI of 30 and above, you are at risk of having diabetes. If you overweight, BMI of 30 and obese, BMI of 30 and above, you're at risk of having diabetes. Your risk of having diabetes is actually doubled. Okay. Now, if you also smoke, I was talking about before another question came in. I was talking about PAD, peripheral artery disease, that can predispose one to having a sore that may not heal.
At the lower part of the body.
At the lower part of the body. One of the strongest risk factors for peripheral artery disease is smoking. So if you're smoking, you need to stop. Diabetes is actually number 2 for peripheral artery disease. Okay.
Doctor, is it possible we continue next week?
Doctor, please, we would love
I'm
to
sure we
continue.
still have
This is
questions,
very
yeah.
interesting. Then, Doctor, please, we also like you to do justice. Maybe you can help us take it down for that of the slimity, which is those suffering from low
blood
sugar.
Yes.
We've had that too.
Sorry,
So
viewers at home.
thank you. Goodbye.
We'll be back next week.